This video is an overview of the Midmark Digital ECG patient preparation. Always refer to the appropriate technical documentation for the complete list of instructions, safety alerts, and sequence of procedures before conducting any service or maintenance operations. Patient positioning. The care of your patient is of the utmost importance, so making sure you obtain the best ECG tracing is a priority. Some scenarios that may cause a noisy ECG tracing or inaccurate ECG reading include improper patient preparation, improper electrode placement, patient movement, and dried or expired electrodes. In this section, we will cover best practices for prepping the patient to obtain a good, clean tracing. Deviating from these best practices could lead to artifacts and interference, making it necessary to repeat the test or possibly causing an incorrect machine-based diagnosis. To prepare for an ECG test, your patient must be undressed from the waist up and lying comfortably in the supine position on an exam chair. If your patient is not comfortable in this position, you may raise the back of the exam chair slightly or offer them a pillow that can support their back, neck, and shoulders. For female patients, ask them to remove their bra, explaining that it enables access to the correct electrode sites, and ask that they wear an exam gown so that it opens from the front. ECG testing is a highly sensitive test. Your patient must relax during the procedure. If your patient is nervous, shivering, talking, or moving, it will create muscle noise, causing artifacts and inaccurate readings. It is very important to keep your patient comfortable, warm, and at ease with arms and legs fully supported on the exam chair. Electrode placement. Proper placement of the electrodes is an important step to any accurate ECG reading. Refer to the electrode placement diagrams on the Midmark Digital ECG Quick Reference Guide included with the product. Patient prep. A good prep supports the best condition for an artifact-free recording and the most accurate outcome. If the patient has body hair, the electrode may not stick to the skin optimally, risking a bad ECG tracing. Therefore, it is important to remove any excessive hair. Reassuring your patient helps relax them, reducing unwanted muscle activity and optimizing the ECG recording quality. If all these actions are performed, a quality ECG will be recorded. If the test is not done correctly, it could result in the need for a retest or make accurately interpreting the ECG challenging for the clinician. The patient's body may have lotion, sweat, or other barriers that are invisible to the naked eye or touch, but can prevent good conduction of the ECG signal. Following the electrode placement diagrams, shave the appropriate areas, clean the skin of the electrode sites with mild soap and water, and allow to air dry before placing the electrodes. Make sure the electrodes are fresh, moist, and not past their expiration date. As you remove the electrodes from the backing, avoid touching the sticky portion of the electrodes. The oils from your hand or glove will reduce the electrode's ability to stick properly to the skin. Now, place the electrodes on the patient's prep sites as indicated on the electrode placement diagrams. For best cable management, place the electrodes with the non-adhesive tab pointing toward the midsection of the patient. For limb leads, place an electrode on a distal portion of the right lateral side of the upper arm below the shoulder for the right arm. Place an electrode on the inside calf midway between the knee and ankle for the right leg. Place an electrode on a distal portion of the left lateral side of the upper arm below the shoulder for the left arm. Place an electrode on the inside calf midway between the knee and ankle for the left leg. For precordial or chest leads, place an electrode for V1 on the fourth intercostal right margin of the sternum. Place an electrode for V2 on the fourth intercostal left margin of the sternum. Place an electrode for V4 on the fifth intercostal left midclavicular line. Place an electrode for V3 midway between the V2 and V4 on top of the fifth rib. Place an electrode for V5 on the horizontal level of V4 at the anterior axillary line. Place an electrode for V6 on a horizontal level of V4 at the metaxillary line. For more detailed information about patient preparation, please refer to the Midmark Digital ECG Operation Manual. For further support, contact Midmark Technical Service at 1-844-856-1230, option 2,